Okay, so this is the continuum of relapse, trauma, recovery. That recovery happens when you work through your trauma. So in this poster, this is the person who's in the trauma. They've got a rope around their waist, and they've got friends who are pulling them to go this way into relapse, and they've got friends who are pulling them this way to go into recovery. It's easiest to go down into the relapse because as soon as you take a drug, you're going to feel the way that you wanted to feel. You're going to escape yourself for a little bit. But the truth is that wherever you go and whatever you do to get there, when you look around, there you are. So if you take drugs in order to stop feeling the way that you're feeling, anxiety, depression, hopeless, insecure, you take those drugs and it will make you feel as if that's all gone and you feel like life is all tranquil and wonderful, but it's not. Everything is still happening. You're just not aware of it anymore. You've altered your state of mind in such a way that you're no longer dealing with it physically, mentally, or emotionally. So that's one way you could go to get out of the trauma. Staying in trauma is not going to be an option for you. It's too stressful. You're going to get out of it one way or another. The other way is not an immediate gratification of relapsing into drugs, but it is a longer, harder road to have to go uphill, but there are people who will help you. There's 12-step programs, there's counseling programs, there's churches, there's all kinds of services out there. Most states have a program called Community Information and Referral. It may go by a different name. Here in Arizona, it's Community Information and Referral, and the phone number is 211. And if you call that number, an operator will answer the phone, ask you what kind of services you think you need. You can describe to them your situation. If you don't know what services you need, you can describe your situation, and then they will look up services that fit what it is you need help for. If you know that, say in my case, I'm a 60-year-old man who, if I relapsed and started using drugs again, that I would go, I've had a relapse and I need to get to a halfway house, because if I don't live in a halfway house for the next few months, I'm going to continue using. But I might need a treatment center first and then a halfway house. But so then they would look up and say, okay, so in the area of town that you're at, here is halfway houses. Maybe I want one for men only. Maybe I even want one for older men, because I feel like that older men might identify with me better than if I'm in with a bunch of men and women who are 18 all the way up to past my age. It's like I might feel like I want to narrow the scope of what the house does and who they take in. So I can do all of that, and they'll tell me what's available. If what I'm asking for isn't available, they'll give me the next best thing. So find out in your community if there's a phone number that you can call or a website where you can look up your own services. But most places do have something like that. So if I'm in this trauma, I can work through this through recovery and get out of trauma. Again, I can't stay there. I can't. It's just too stressful for me to be in trauma and stay in trauma. I've got to get out of there. This is immediate gratification. Do some drugs, get drunk, feel better for a little while. That wears off. Now I'm not only anxious and depressed to the level I was before, but I'm deeper in the hole, and that I've got to work my way out of that somehow. I can just keep doing drugs until I OD, or till I have an accident, end up in an institution, in jail, or dead, or I can work a recovery program and work my way out of it. It's not immediate gratification, it's delayed gratification, but my life will get better and stay better as long as I stay in recovery. And I will be able to have that trauma be something that existed in my life, but that I've recovered from it, and I've got my sense of security and hope back. I'm living my life according to healthy values, and the rest of my life can continue to move forward in a positive way with the trauma behind me, instead of continuing to have that trauma be escape from the trauma into drugs and then come back to the trauma, escape from the trauma into drugs and then come back to the trauma. So in the long run, the relapse is not a good choice, but when we're in trauma, we're not thinking our best. So a person will often fall for that immediate gratification. But eventually, if they live, they will recognize they need to do something else. So that's this poster. another recovery type of a poster, and it says, change your values, change your life, and if you don't, you won't. So here's a young lady. She was all wrapped in barbed wire so that she was not able to move at all, and then she chose the recovery path, and the barbed wire turned into vines with flowers, opened up, and she was able to live her life in a different way. But again, if you have values of being unsafe, dishonest, disrespectful, and irresponsible, then if you continue to live by those values, you're going to get the life that goes with those values. And if you change your values to being safe and honest and respectful and responsible, your life will change according to the values that you're now living by. So you were this person and now you're that person. Or you stay the same values and you stay the same person. So we can make the choices as to what our values are going to be and the way we're going to behave, and we can change that from 1 minute to the next minute. So you don't have to be stuck. But again, when we're in trauma, we often don't know that we don't have to be stuck. So hopefully some of you will get this message from me. Some of you will have someone else who comes along and tells you they're willing to help you. And you can find a support group, like a 12-step support group, or again, a church group, or a counseling, or a behavioral hospital, or there's all kinds of services out there available to people. And my mission in life is to try to be of service to people and get them from the traumatic state that they're in, out of that crisis, and into a healthier way of living.